Hi, my name is Jennifer Wyatt, and this is a presentation on the U.S. healthcare delivery system. The U.S. healthcare delivery system is made up of many different parts. The three main parts I will be discussing in this presentation are the providers, the settings, and the purchasers. To get started, let's talk about the U.S. healthcare delivery system as a whole. The United States is the only profit-motivated healthcare system in the world. Instead of having a universal healthcare system with universal healthcare coverage, the U.S. healthcare system is a combination of private and public payers, inpatient and outpatient settings, and many different types of providers, including primary care providers, specialists, and many other allied health professionals, making it a fragmented system where citizens have to obtain health care through different means. It is important to understand how the U.S. healthcare system is set up and how it operates in order to understand how and why we have so many inequities and disparities throughout the healthcare system. Although most people believe that, as citizens, we all should have a right to health care, according to Crowley et al., nearly 30 million people remain uninsured, with millions more underinsured, and the number of uninsured persons is expected to grow. These statistics paint a picture of a healthcare system that is failing to achieve what it was created to achieve, which is providing healthcare to its citizens. In addition, the U.S. spends more on healthcare than any other country, yet, comparatively speaking, from a global perspective, the U.S. still has one of the lowest life expectancy rates, one of the highest suicide rates, one of the highest chronic disease burden and obesity rates, some of the highest number of hospitalizations from preventable causes, and sadly, the highest rate of avoidable deaths. It is also important to note that although the U.S. healthcare system trails behind in many areas, it outperforms its peers in terms of preventive measures with preventive screening and vaccination rates. Now that we have been introduced to the U.S. healthcare delivery system, let's move on to discuss the providers within the system. Providers. The U.S. healthcare delivery system is made up of many different types of providers. Traditionally speaking, primary care providers who, like their name states, provide primary care to patients by serving the role as point of entry for most people into the healthcare system, coordinating care and providing treatment based on treating the whole patient. According to Shai and Singh, primary care is a central function of the country's health system, and it is the main focus of the overall social and economic development of the community. Basically speaking, citizens' access to primary care services in their community directly reflects the equity and quality of healthcare in a community. Primary care providers include family practice providers, generalist, and community-based providers. The role of primary care providers in the U.S. healthcare delivery system is so important that the Affordable Care Act included 4 major provisions related to primary care, including increased Medicare and Medicaid payments to primary care providers, new scholarships and loan repayment programs for primary care providers working in underserved areas, and creation of additional training programs to train primary care providers. Most underserved communities are rural communities and low socioeconomic communities that are comprised of vulnerable groups, including low-income minorities and homeless people. Specialists. Specialists are providers that provide specialty care. Historically speaking, providers practice as primary care providers by treating every health issue that a patient presented with. As the practice of medicine evolved, specialty training programs developed, leading to what we know today as specialists. The draw for patients to see a specialist is the premise that the specialist is better trained to treat the ailment they are specialized in treating, and they are more knowledgeable about that ailment than a primary care provider would be. According to Anderlini, overspecialization in healthcare has been a failure for patients and budget altogether. In addition, the unbalance between the number of specialists and generalists is the threat. While specialists do have their place in providing care, most of the time specialists are affiliated with larger urban health systems, making it difficult at times for certain patient populations to access specialty care. In addition, specialists spend a significant amount of time training in inpatient hospitals where they are exposed to state-of-the-art medical technology. Because of their affiliations with larger urban health systems and their specialized training, their fees for services are usually higher than a primary care provider's fees. Allied health providers. Allied health professionals include many other healthcare providers, such as dentists, chiropractors, nurses, advanced practice nurses, therapists, and dietitians, among others. All these categories of providers provide important healthcare services to patients. Most of the care given by allied health professionals is provided for patients covered by insurance, private or public. Community-based programs and charity services provide very limited care from allied health professionals, and most of the care provided is through volunteer work. Settings. When discussing healthcare settings in the U.S., there are two broad categories, the inpatient setting and the outpatient setting. Although both settings provide care to patients, the outpatient setting primarily provides care to patients that have some type of insurance coverage, private or public, while the inpatient setting generally provides care to all patients regardless of coverage status. The inpatient setting. The inpatient setting includes general hospitals, specialty hospitals such as orthopedic and psychiatric hospitals, rehabilitation hospitals, children's hospitals, and long-term care hospitals. An inpatient stay in the hospital is generally defined as a stay greater than 23 hours and includes an admission order to the hospital by a provider. Historically, hospitals were places where the poor and destitute received care. As the U.S. healthcare delivery system evolved, hospitals became places to treat all patients, regardless of socioeconomic status. Because of the growing cost of providing care in the inpatient hospital setting, more and more healthcare services have become available in an outpatient setting. According to Finkelman, hospitals that do not bring in enough money to pay their bills are said to be operating in the red, and many hospitals in the U.S. are operating in the red. This is a serious problem for the healthcare delivery system because it has led to the closure of many hospitals, affecting access to care for vulnerable population groups who already face inequality in healthcare. People living in low-income communities have higher hospitalization rates and greater lengths of stay compared to those living in higher-income communities. When a hospital who serves vulnerable populations is forced to close, it creates even more disparity in the healthcare delivery system. The outpatient setting. The outpatient setting includes all healthcare services provided on an outpatient basis. Doctor visits, including primary care, specialty care, and urgent care appointments, outpatient therapy services, imaging and laboratory services, home health services, outpatient surgery centers, and many other services. There are several factors that have contributed to the shift of healthcare delivery from inpatient to outpatient settings, including reimbursement, technological factors, utilization control factors, physician practice factors, and social factors. To try to gain back some profit from healthcare delivery, many hospital systems have opened outpatient services and partnered up to provide outpatient services. Purchasers. It is impossible to discuss the U.S. healthcare delivery system without discussing the role of purchasers. Because the U.S. does not have a universal healthcare delivery system, there are two main categories of purchasers to discuss: public payers, which are government programs, and private payers, insurance programs. Outside of these categories are the uninsured, vulnerable population groups who do not qualify for either type of insurance coverage. Public purchasers. The U.S. government provides public insurance programs for several different population groups. The Medicare and Medicaid programs provide insurance coverage for the elder and poverty population groups, respectively, whereas the CHIP program provides insurance coverage for qualifying children who would otherwise not have health care coverage. U.S. government employees and politicians, active military, retired military, and certain people who are qualifying former military and/or their families are provided insurance coverage under the Department of Defense. U.S. military veterans are also covered under a program through the Department of Veterans Affairs. More than one-third of the U.S. population is covered under various public insurance programs. The large number of people covered under a public insurance program has directly contributed to the rising cost of health care in the U.S. In 2018, nearly 18% of the nation's gross economic product which would be $3.6 trillion, was directed to healthcare. Private purchasers. Private purchasers, on the other hand, are comprised of all private insurance programs, including managed care programs and individual purchase programs. It is important to note that in the U.S. healthcare delivery system, insurance is the main factor that determines the level of demand for medical services. This is important to understand because supply and demand for healthcare services are directly linked to the overall healthcare expenditures. With rising healthcare costs in the U.S., greater national healthcare expenditures occur, leading to increases in insurance premiums and increases in both inpatient and outpatient services. As a result, millions of Americans are struggling to pay insurance premiums. Family premiums for employer-sponsored insurance have increased 54% since 2009, outpacing inflation. With the rising cost of private insurance premiums, many people are refusing insurance coverage and instead relying on hospital emergency departments for access to their healthcare needs. Public purchasers are motivated to negotiate for better rates for services rendered because they seek to save money where possible while providing access to care for America's most vulnerable populations. All these issues contribute to the inequalities in the U.S. healthcare delivery system. According to Williams et al., financial barriers have been shown to influence health outcomes, and socioeconomic disparities often underlie or partially explain racial disparities. The U.S. healthcare delivery system will never achieve its purpose of providing healthcare to its citizens without acknowledging and addressing inequalities and disparities in the current healthcare delivery system. While there are many great benefits and programs within the healthcare delivery system, there are still many changes and improvements needed to meet the needs of all Americans. Thank you.